Our next speaker is Dr. Robert DeJonge. Dr. DeJonge is well known in the area of anti-aging and complementary medicine. He has a very comprehensive clinical approach to treating the patient, and we know he does a good job because many of his patients are A4M member physicians. Dr. DeJonge.
Is this on? Oh, thank you. I guess it is. First of all, the first time I met this on-the-med device, a friend of mine who had a pituitary dysfunction, which goes along with Mark Gordon's talk, and the person testing had no idea they had a pituitary dysfunction. The on-the-med went over the person's brain and said to the doctor, "You have a pituitary dysfunction." And well, how do you know this? It has to do with frequencies. The first time they went over me, any health problem I had, and I was dressed sort of like I am today, they found about everything wrong with me that I knew that was wrong with me, and I had never met this person before. So I've been doing energy medicine for a number of years. Earlier today, if you were fortunate enough to catch Pat Kane's lecture at 7 o'clock, she is a brilliant, passionate person who does cell membrane physiology. And in her talk, she talked about cell membranes and the vibrational frequencies. And it's great to have vibrational frequencies, but they can't be dysfunctional. They have to be harmonious. And the frequencies are what this talk is about. It's about cell membrane physiology. It's about Mark Gordon and hormone replacement, because these people with Lyme disease have hormone disruptions from the 150 different Lyme toxins in their body. And so I'm going to try to integrate some of the lectures that have already been presented. This talk is on Lyme disease, the great masquerader, the great imitator. I don't know how many people, is that where you see things? This is called the Townsend Newsletter. The whole issue, which just came out, I wish I knew it before I wrote my talk up, is on Lyme disease. So for additional information, please look at that. Lyme disease causes its damage by the release of 150 toxins. It's not the germ. I always tell people it's sort of like Clostridia tetani, stepping on a rusty nail. You step on that nail, it's the toxins that cause the lockjaw. Okay, it's not the germ. The germ's releasing the toxins. And so part of getting better is to kill the germ, remove the toxins, and repair the damage to the cell from the toxins. And let's start with the first slide. Oh, I have the control here. Let's see. All right. I really worried the people here. They looked at my slides and they said, "You're not going to read all that." And I said, "Definitely not." But just some general information. Lyme disease is caused by the bacterium Borrelia burgdorferi. It's transmitted by ticks. Some people say it's transmitted by other forms. Typical symptoms include a fever, headache, fatigue, and there's a characteristic skin rash, erythema migrans. Well, this occurs in about less than a third of the people. And I do Lyme disease day in and day out for years. If left untreated, and that's the point of this talk, it can cause joint problems, heart problems, and neurological problems. And Lyme disease, this is another key point, is based on physical findings, not a blood test like an H1C that's, 7.2. Clinical findings. Now, there's no real good blood tests. More and more blood tests are coming out, and I'll tell you some tricks on how to have your patient develop a positive IgG and IgM Western blot as we go along. Some people say that Lyme disease can be successfully treated in 2 to 8 weeks of antibiotics. And I can tell you some stories about, well, that's great. That happens a lot of times. But there are some people who after 8 weeks of antibiotics, they're no better. Could be the wrong antibiotic. Or they just have the disease. When it gets into your body, it replicates really fast, not slow. And sometimes people, if they don't have a rash, they don't have a tick bite. And by the way, I'll show you a picture of the different cycles of the tick. And the nymph is really small. And a lot of people cannot see the small nymph tick bite. Anyway, you should use insect repellent. I was just on a farm I have, and I had this child with me. I made sure he had long pants, and he tucked his pants inside his socks before he went out into the fields. Because this is the time of the year, the spring and the fall, when the nymph are out there hanging on the grass, ready to jump on your leg, crawl up your pants. And so many of my patients come in that have the rash, and they have these bullseye rashes up on their thighs that are just gigantic. This is really interesting. Lyme disease is nothing new. Got to go to the next slide. And it's hard to read that. It dates back to 1883 in Germany. And you can go on to see the erythema migrans in 1909 in Sweden. And then in 1970, it was reported in a person in the United States with the erythema migrans and related to the deer tick, Ixodes. And then there was the cluster of patients in 1977 in Lyme, Connecticut. And it was like, this is women doing their best, mothers. All these children developed juvenile rheumatoid arthritis, and the frequency was so high they said, something must be wrong. This cannot be happening. And then they related it to Lyme disease, okay? And it was the famous Willy Borgdorfy, who was working on tick diseases, who discovered and proved that the spirochete, this very sluggish spirochete, would spread from a tick bite into the body and cause a disease. So really, our understanding started in the 1980s with Willy Borgdorfy, who we named the germ after. Okay. Now, here is the life cycle of a tick. And if you look at the not the littlest one, but the second littlest one, that is a nymph. And that's what's out in our fields right now. And that nymph is the one that transmits the disease the majority of the time. And that nymph is on, you can see the scale of an inch. Look how tiny that is. And the deer contains thousands and thousands of ticks. And I see, being from Michigan, I see deer hunters. I see people from out west, elk hunters. I used to catch bats for the University of Arizona. They were full of ticks. But these ticks can be so small, you don't see them. And so it's these nymphs that are responsible for 80% of the disease, we believe. But we don't know enough about this to be 100% certain. Oh. Now, other forms of transmission. I take care of whole families with Lyme disease that come from different parts of the Midwest. And these children have no exposure to ticks. They haven't been deer hunting yet. And yet they test positive with Western blot testing. And if you talk to the mother, well, she grew up in Pennsylvania, she grew up in Connecticut, and she might or might not remember having ticks on her, but there is transmission in utero. And in this Townsend newsletter that I showed you, there are doctors who say that the majority of autistic children, the majority of a lot of other neurological diseases in children are related to Lyme disease. Well, whether it's the MMR, and I do autism also, and I speak for the Autism Society, and Dr. Remlin was as passionate as Pat Kane is now, and we just lost Dr. Remlin. whether it's mercury or Lyme toxins, they both involve the cell membrane. And the removal is very similar. Okay, so using like phosphatidylcholine and glutathione and phenylbutyrate, those things straighten out the cell membranes. And by avoiding certain foods that cause very long-chain fatty acids and damage to the cell membranes is how you heal these people. You have to detoxify these children. It's hard to get these autistic kids to sit still for these nutritional IVs. The adults are much better. Other forms of transmission, well, this is very similar to syphilis. In fact, I have a degree in brains, and one of the jokes used to be, if you biopsy the brain of a neurosyphilis patient, what do you find? You find two neurons connected by a spirochete. So, there's your joke for today. Anyway, Lyme disease and syphilis are very, very similar, and they can cause damage to many parts of the body, and the damage can go undetected for a long period of time. Now here's a tick, and here's a tick bite, and I've had people come in, and they go, I got this new mole on the back of my neck, and I can't get rid of it. And it just popped up overnight. And I look back there, and here's this tick in the nape of their neck, and I'm going, well, we'll get rid of that mole real fast. And I have this little device that's handed out by the ILAT Society. It's a special type of tick removal that just skims underneath the tick, and with very little pressure, it lifts the tick off. You don't want to destroy the tick. You don't want to push him real hard. You want to get him to release. These tick bites, you see the rash maybe 3 days to a week or two later in a third of the people. But a lot of people don't see the tick bites. So that would be great if we had tick bites. One of my favorite stories, I have a PhD ecologist from Kalamazoo, Michigan, comes in to her family doctor, said, I pulled a tick off my head. I had a bullseye rash on my face. I mean, not a very pretty sight. And my doctor treated me for 4 weeks with doxycycline. And I felt initially well, and now I have symptoms of chronic fatigue, fibromyalgia, brain fog, on and on. And I said, why did he stop treating you? Well, my blood test was negative. My ELISA test was negative. My IgM and IgG Western blots were negative. And I said, well, didn't he read the CDC? Diagnosis is clinical. You have a tick bite, you have a bullseye rash, you had 100% Lyme disease. We treated her a little longer. We detoxified her. We repaired her cell membranes, and she's working full time. Now, when you get bit by a tick, it's almost as bad as being bit in a bar fight. Because when you get bit in a bar fight, you get all these different germs in your skin, and it's one of the most difficult things for an infectious disease doctor to treat. When you get bit by a tick, you might get all these other illnesses transmitted at the same time. And there's illnesses called ehrlichia, anaplasmosis, babesiosis, Rocky Mountain spotted fever. Some people say mycoplasma. I always check for candida. And you're doing a disservice to the patient if you just treat them for Lyme disease. Diagnosis. Once again, it's a diagnosis based on symptoms, objective findings, a rash if it's present, facial palsy. You give me a patient with Bell's palsy, trigeminal neuralgia, most likely they have Lyme disease. And then you have to consider the other diseases that may cause this illness, and you have to treat those at the same time to get improvement. And it talks about laboratory testing. And since laboratory testing would be a whole lecture in itself, and it's confusing and it's not helpful all the time. I'll tell you one trick about laboratory testing. Person comes in, very commonly, they have the history of Lyme disease, they could even have the rash. I go straight to a lab in California. In the United States, there are 60 major labs, like Quest Lab, etc., LabCorp. In California, there's a lab that specializes in Lyme disease only. It's called IGeneX. IGeneX lab, they are the best. They get the most positives. They're the most accurate. And I tell my patients, sure, we'll do the test at the local laboratory through the local hospital, but don't be discouraged if it comes back negative. I'm still going to consider Lyme disease as one of your diagnoses. So these people, then the test is negative. I say, let's go to IGeneX. We do the IGeneX test, and it comes back negative also. Well, what I do, and these are chronic Lyme patients usually, I put them on doxycycline, 100 to 200 milligrams twice a day for 1 month. Come back in, I repeat the same test. It's positive most of the time. What did I do? Nobody's really sure, but since we're measuring immune system function, and your immune system is beat up from attacking this disease, by giving antibiotics, we sort of take the workload off the immune system, so we have something more to measure. Now here's a rash. And these rashes can be small, or they can be huge, taking up your whole thigh. One patient who was in the military in Maryland, and this is before Lyme disease made the cover of Newsweek, was walking around on base with shorts on. And a day or two later, he noticed this huge rash, or a week later, when he was taking a shower at the military base, on the back of his thigh, his buttocks, the medial aspect of his thigh. And then he became ill with flu-like symptoms, and he was never right since then. A couple years later, Time magazine had a big picture of a bullseye rash on the cover of it. He goes, that's what I have. He goes to the doctor, they do the regular Lyme test, and it's like, well, you don't have Lyme disease, your test is negative. And then later on, he came to me, and we did the trick I just told you, and he tested positive. And he actually took a demotion in his job because his brain fog and fatigue were so bad. He has 3 children, couldn't spend any time with them. Today, he is doing a full job, and he's taking care of his family and having a good time. It feels wonderful. So a rash is nice if you have it, especially if it's in the front of your head, but it's not always there. This is testing again, and we're going to skip testing. And we're going to get to ILADs. Now, there's 2 groups of people who treat Lyme disease in the United States, 2 major groups. The Infectious Disease Society of America, and there's ILADS, International Lyme and Associated Disease Society. I'm a member of ILADS because the big difference between the 2 groups is infectious disease doctors think Lyme disease is something that you treat for 8 weeks, and after 8 weeks, there's no more. You don't need to give them antibiotics anymore. You're done. Okay? Well, for the people who don't respond to 8 weeks, that's terrible. And insurance companies and Medicare and all these people get concerned, well, this person can't have Lyme disease. You treated them for 8 weeks, and they're still sick. It must be something else. And so ILADS believes in these things, that it's transmitted by a tick, it's prevalent throughout the world, it has no borders or boundaries. Okay, no borders or boundaries. Okay, this 50-year-old vice president of a major company in Detroit is at the Minnesota airport, and she's just coming back from a meeting, and she's waiting for her plane to go to Detroit. And 4 hunters, this is in November, come and sit next to her. And they're dressed in their camouflage, and, they're having a good time, and she doesn't think anything of it. Gets home the next day, wakes up, has a bite on her, and is not sure if it's a tick bite or not. And the next thing you know, she's seeing 10, 15 doctors. Rheumatologists, infectious disease doctors, internists, dentists. A lot of these women get jaw pain with this disease. Had a couple teeth pulled, bruxism, braces, whatever, bite splints. And it's all from being in the airport at the wrong time. And it's just like, it has no boundaries. My brother-in-law in New Jersey, his cat came in from outside, sat on his lap, and a day or two later, he had a rash on his abdomen. Came down with Lyme disease, took antibiotics for 4 weeks. He's all better. An astute doctor. Number 2, Lyme disease is a clinical diagnosis. Once again, do not rely on lab tests. Rely on your suspicious mind, your open mind. It says fewer than 50% of the patients have a rash or even recall a rash. And the rash isn't always bullseye. My golfing buddy, who's a surgeon of 35 years, his son goes to the University of Wisconsin, comes home for spring break or something, and he has the flu. Goes to see 3 or 4 doctors. He has fatigue. They don't know what's wrong with him. They say he has some sort of viremia, but it won't go away. A month or two goes on. He has this macular-papular rash on his body. No bullseye rash. His father says, finally, go back to the University of Wisconsin, take, a few credit hours and just let's see what happens. He goes back to school. He sees a dermatologist on the campus. Dermatologist says, well, this is an atypical Lyme rash, puts him on antibiotics for 2 months. And today he's doing fine, and I believe he's in law school. So the rash isn't always a bullseye rash. Fewer than 50% of the people recall a tick bite. The Center for Disease criteria was designed for surveillance. It wasn't designed for diagnostic purposes. Number 6, ELISA screening is unreliable. Sensitive tests are supposed to have an accuracy of 95%. The ELISA test is about 65%. And this is the difference between the two societies, and we don't want to get into that. And now you get to what happens when different states say that, well, Lyme disease is only an illness that lasts 2 weeks. And so people have protest rallies. And with the new IDS guidelines, some people don't even get diagnosed and treated in time. Some of them don't get the proper treatment. It empowers insurance companies to deny diagnosis. I can't tell you how many times an insurance company, the person has neurological Lyme, a lot of times we use Rocephin, and the insurance company says, hey, you can't use Rocephin unless the patient pays for it. So they're cut off. And so there are protest rallies. There is even in one state, I believe it's Connecticut, where the Attorney General is investigating IDSA recommendations because of so many complaints. And so here's the Baltimore Sun newspaper talking about that the illness is easily misdiagnosed and frequently undertreated. And the most contentious piece of the IDS guidelines is the claim that long-term use of antibiotics is not a remedy. And here's a flea. Some people say fleas might transmit Lyme disease. Well, if you get a bite like that and they can transmit, some people say mosquitoes can, we're in trouble. All right. Now, there is a research base for Lyme disease. And the interesting thing about the research base, one too many, is this. This is critical when dealing with Lyme disease. If you suspect you have Lyme, it is crucial that you get a reliable test as soon as possible and a course of treatment immediately, because the longer the germ grows in your body and damages your cells and releases toxins, the harder it is to make a person better. Some people say, how long does it take me to get better from Lyme disease? I got bit by a tick 5 years ago. I was never treated. Well, we say it takes 3 months for every 1 year that you've been bit since you had treatment. And then common misdiagnosis, and this is the point of the lecture. They wanted me to tell you that people with a diagnosis of Parkinson's disease can have Lyme disease. I have this lady who was at 2 neurologists in Grand Rapids, went to Mayo Clinic, told she had Parkinson's disease. Her IGeneX testing was positive. We did a combination of things. We did the phospholipid exchange, the glutathione, we detoxified her, repaired her cell membranes. We gave her supplements, and when I give people supplements, every 6 weeks I change them based on their biomeridian testing, whether it's you use kinesiology or different biomeridian machines. We use the on-demand machine that Jim was talking about to put energy into the body. If you want to consider it jump-starting their cells, I call it balancing their energy, because life is a balance of energy. Some people have too much and you have to lower it, so jump-starting is not a good term. But anyway, after 3 months, this lady's Parkinson's syndrome was gone. She wasn't depressed. She didn't have ART, akinesia, rigidity, or tremor. And now it was just, she felt wonderful, and she had been to all these other doctors. Multiple sclerosis. Hardly a week goes by with somebody with MS, doesn't come in. I've been diagnosed with MS. I'm disabled by the state of Michigan because I have MS. I just had a pharmacist come in. I have MS. Well, MS causes white matter changes in the brain, and it's indistinguishable, Lyme versus other MS. And spinal taps also show the bands, you have oligoclonal glands. So you got spinal tap changes, you have MRI changes that look exactly the same. But once again, if you go through the program that I just talked about, these people are up and about, and their MS symptoms don't vanish, but slowly go away. Chronic fatigue is very common. Rheumatoid arthritis. I have this nurse with rheumatoid arthritis. She couldn't kneel down on the floor. She lives on a farm. She had trouble just doing anything in the house, any household chores. And by treating her when she tested positive for Lyme disease with homeopathic remedies and some supplements and energy medicine, she can kneel on the floor, she can get up, she can move around. Oh, by the way, Jim talked about healing bones with non-union with electromagnetic fields. About 5 or 6 years ago, somebody developed a brace that you wear on your knee that puts an electromagnetic field in your knee to make knee pain go away. That's called Bionicare. I also gave this lady a Bionicare. I've lectured on Bionicare and physical supplementation before. Knees, for some reason, are a rate-limiting step in us being healthy. And so if they have knee problems, you can use electromagnetic medicine, visco supplementation, and detoxification. Alzheimer's disease, a lot of these people test positive. Lou Gehrig's disease, some of these people test positive. Lupus, that's somewhat, I don't see that many lupus, but I do see a fair number of sarcoid patients. One of the things that got me started is this deer hunter who was executive of a big energy company like BP, couldn't work anymore. He presented when he was on a meeting in Atlanta to the emergency room with chest pain. Your heart's fine, sir. You have myositis. Okay? Comes back, they work him up for chest pain, they bougie him, they do an EGD and expand his esophagus, they put him on proton pump inhibitors, this and that. You have panic attacks, you have this, depression, we'll put him on SSRIs. He comes to see me, tests positive for Lyme disease. Never been bitten by a tick, never had a rash. We only gave him probably a month of doxycycline, and we did the detoxification and these other programs. We also used far-infrared saunas, and there was a great lecture on far-infrared saunas the other day, and they're great for removing toxins from the tissues for the people with muscle pain. Anyway, he's back to work full-time. Now, here's an interesting, here's an ALS example. iLads welcomes a physician recovering from ALS. And It says, after 6 frustrating months with hope fading, Dr. Martz discovered the work of Gregory Bach of Pennsylvania, who's a member of ILADS. He suggested a link between Lou Gehrig's and Lyme disease, sought out an ILADS physician, and was treated. The results were dramatic. Before I found Lyme-literate professionals, I could only function at a level of 20%, says Dr. Martz. Now that I am up to 75% of full function, I hope to work soon as a physician helping others with chronic Lyme. He's an internist and past president of the Colorado Medical Society. He says the Center for Disease Control says that Lyme disease may be underreported by as much as 10-fold. That means as many as 250,000 Americans may contract Lyme disease each year, and they're unaware of it. So I hear these stories all the time. I see them in my office. And now we're going to go to, there's a site about Lyme disease and multiple sclerosis. And this Lyme site tells you about many patients with MS who do well when they're treated for Lyme disease. Most ILADS doctors, though, use pretty much just antibiotics and probiotics, some supplements, some homeopathics, but they're not really, as Jim was saying earlier, holistic, as much as I wish they were. But they're getting there. And so these are just multiple cases from the internet on people with Lyme disease and MS. Okay, friends with MS. Toxins. If we back up just one or two. There's a slide here that basically says you get the exact findings with the MRI and the spinal tap that I mentioned earlier. But we'll move forward to actual studies that show that investigators in Germany show that bacteria secrete lipoproteins. These are immunogenic and have signal functions. They're seen with chronic bacterial infections like Lyme. And experimental models show inflammation and severe damage in the skin and the joints. Once again, it's the toxins, not the germ, that's causing most of the problem. The potential of the battery of native and recombinant lipoproteins to initiate tissue injury in rodent models for reactive Lyme arthritis and skin inflammation are being analyzed. Speaking of Germany, there's a lecturer we have here occasionally on cancer named Dr. Dowis from Clinic St. George. And I work with Dr. Dowis, and I've had a patient or two go to Clinic St. George and receive whole-body hypothermia. In whole-body hypothermia, we use infrared heat, and we heat your body up slowly to 107 degrees, keep it there for an hour, and bring it back down. Now, I send a lot of cancer patients out of country, and when they come back in the country, I sit down and I interview them. And I said, what's the most amazing thing you've seen over in Germany? And you expect them to say a pancreatic cancer patient that's still alive, a glioblastoma patient that's still alive. And this one stage 4 prostate cancer said, I met this man from Georgia who had Lyme disease and could hardly walk when he got over there. After 2 whole-body hypothermias, he was like cured. He had no problems. Well, heat kills germs. Heat causes heat shock proteins to be released. Heat builds up your immune system. Sweating, you sweat, 5 to 7 liters in a whole body hypothermia treatment, 7 liters of toxins. And this was a remarkable thing. So I sent a lady with Morgellons disease, which is, people think they have paranoid psychosis or delusions of tearing bugs out of their arms and pulling bugs out of their arm, with Lyme disease to Germany. And sure enough, their Lyme disease was gone when they came back. Their Morgellons disease started to go away, and then it resurfaced. So it's not a cure for Morgellons disease at this time, but it works great for Lyme disease. So this is called an Asira machine. You could do cookbook medicine, which means you say, okay, everybody with Lyme disease take these antibiotics, these supplements, and detoxify this way. Or you can say we're all unique individuals. We all have different toxins and different amounts of the same toxins. And we could figure out what program works best for you, but we'll use the cookbook as a guideline. And that's what I do, and I adjust the patients, and it saves a lot of phone calls. Because if you put everybody on the same amount of supplements, they have reactions. They detoxify too fast, who knows. But you don't get phone calls when you do it this way. You can do this with kinesiology testing. I learned that a long time ago. This is faster. On top of that, with this computer here, what we do is we can put the frequencies of their health problems in a vial of potato vodka. And I can take an LED laser, and I can run the laser up and down your body, and it will stimulate your acupuncture meridians of your dysfunctions. And I've had some of the most remarkable results with this. I learned this from a Dr. Cowden, who's a cardiologist, and it's a wonderful treatment. Biofeedback, you heard Dr. Oshman talk about the OnDemed. All my Lyme patients get OnDemed treatments twice a week, half hour, and they all say it improves their health. And glutathione, if you attended the 7 o'clock lecture, glutathione was started with, like Dr. Perlmutter, in Parkinson's disease. But to get it in the blood-brain barrier, we need the phospholipids, and that carries it in, and then you get a much better result. And since my time's running out, this is a big thing. The liver is the center of the storm. Pat Kane mentioned this too. Your liver's your oil filter. If you don't take care of the oil filter, the car doesn't run. So when I make people better, I work from the bottom up. They get colon cleanses, they get colonics, they get liver flushes, and that can be done with IV or oral. And then I go after the tissues, such as the brain. And if you do it the other way around, then you're going to get detox reactions, because you're going to release all these toxins from the brain in the tissues, and they can't escape the body. And I believe that's one of the major bases for the Herxheimer reaction. And then neurotoxins and cytokines, and everybody talked about that. And thank you. If you have any questions, I'll be outside.